Hi guys, in this video I'm going to discuss biceps tendonitis or tendinopathy, which is one of the common causes for pain that you feel over the front of the shoulder. Now we're going to look at the anatomy of the biceps muscle and how it functions, why it gets injured, what activities typically injures it, then also what it feels like. How can you tell if you've got a biceps tendonitis or tendinosis versus other conditions that can feel very similar. And then we're going to look at things you should really avoid doing when you have it that can make it feel worse. And we're going to look at the treatment process. So what to do if your shoulder is really, really, really painful. And then during the rehab phases, what type of things to keep in mind. I'll also touch on other types of treatments you can try in case you find that rehab exercises and things is not useful for you. So for those of you who don't know me, my name is Mareka. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. So have a look at the description of this video if you want a link to our website. Okay, good. So biceps tendinopathy or tendonitis, how does the biceps muscle function and where is it located? So if you look at the picture over there, you'll notice that the bicep muscle is this one. It's your guns that runs down the front of the shoulder. And it has two heads. It's got a long head and a short head. Now the long head, the tendon comes and attaches right inside the shoulder joint, and the short head comes up this way and it attaches round about there. And if you want to find the tendons, the long head's tendon, there's a little dip in your shoulder. It's roughly, mine is around this area where I can feel it. There we go. And the short head's tendon will be more towards here. You can feel there's a bony knobbly bit there. That's your coracoid process. I can never say it. It's written on the thing. A bony prominence from your shoulder blade where it attaches onto it. So the pain, it can either be your long head that's irritated and sore, or the short head, or a little bit of both. Now, I want you to take note of the shoulder anatomy as in a broader sense as well. So if we look at the shoulder, the bone you feel on top there is part of your shoulder blade actually. It has a lip that comes over, and that's the acromion. And it forms the roof or the ceiling of your shoulder joint. And then the humerus head sits in that area, as you can see on the picture. And the biceps tendon, the long head, runs right over that and attaches deep inside. Now, why that's significant is any activity or any time that your shoulder blade is a little bit too far forwards over while you're doing repetitive actions can irritate the tendon. And also, if you can see that bony prominence where the short head attaches, if you do a lot of internal rotation type activities where your arm turns in, that can again irritate the tendon by impinging it in there. So it's just something to keep in mind because we're going to work with that when we look at the rehab process. Okay, so if we think of the function of the biceps, it has two main functions. One is, well, there's three. It supinates the forearm as well, but that's for later on. I'll make a different video about the distal tendinopathy. This one's just about this bit. The main function is it flexes the elbow, so it bends that up. That's when it works, and that's why you can tense it and say, look at my guns. But then it also helps to flex the arm up, so it helps to lift that action. So any time that you're lifting weights where you bend the elbow or where you're pulling yourself up, you'll be using your biceps tendon for that. Now, where do you feel the pain from this, or how does the pain react? Usually, you have no idea that you are overworking or irritating the tendon while it happens. It's usually the next day or several hours after you've done an activity that you think, something starts to feel achy. If it's the next day, it's usually you wake up and you go, oh my word, what have I done to my arm? I can't move it, it's so painful. And the pain is very much located over the front of the shoulder that you can push on it and you can feel it there. Sometimes if it's really irritated and irritates the other structures around it, you can get pain referring down the arm as well, especially the biceps itself. The muscle belly can tighten up. And if it's really irritated, it can affect the nerves sometimes that you get a tingling. But more often than not, if you get a bit of tingling and stuff, you have to have your neck checked as well. And if it's not the other type of injury that's affecting the nerves as well. Other structures in this area that can give you similar type of pain is your pecs come and attach very close to there. You've got your rotator cuff muscles attaching around there that can cause pain over the front of the shoulder. You have your nerves running past there that can cause pain over that area. So it's not to say that if you have pain there, that it is a biceps tendonitis or tendinopathy, but it is one of the things that it could be. Some telltale signs that it likely is if you do resisted biceps contraction and that causes the pain to increase. Could be same thing if you have as if you want to punch to the ceiling and you push against that and it hurts. Again, it could be that, but other muscles also contract during those movements, so that's not a 100% test. So seeing a physio about it is useful because they will ask you specific questions and put all of these little puzzle pieces together to come to a conclusion about your diagnosis. Okay, so that's basically what the pain feels like. Usually it gets worse if you do activities that's above shoulder height. So for instance, having to lift stuff or just driving with your arm up at that height. Because remember where the biceps tendon run and where that bony ceiling to the joint is? If you do anything where your arm is sustained in this position or where you're lifting it above and the tendon is sore, it will squash the painful tendon and that's why it hurts. Now, it's normal for the tendons and things to squash in healthy shoulders, but because they're not injured, it doesn't hurt. So it's only when it's injured that it becomes a problem to lift your arm that high and things like that. So that's definitely one thing that will make it feel worse. Other things that can aggravate it is if you try to lift things up or do exercise that uses the biceps muscle, because remember the muscle attaches into the tendon, attaches into the bone. So any action you use the muscle for will affect the tendon. Stretching makes it much, much worse. So if you bring your arm behind your back or you just stretch it back, and that's something that people often do because it feels so tight and uncomfortable, and it can feel quite nice to stretch it back because the muscle belly relaxes a bit. But several hours later, you may find that, oh, now it's really achy. And that's because injured tendons really do not like being stretched. And you will often find that people tell you that that tendon's inflamed and sore and injured because your biceps is so tight. There are three main reasons why it gets injured. Number one reason is you've overworked it. So you've done a massive strength session that you weren't used to, like a pull-up challenge or a press-up challenge or just really heavy set of weights with bicep curls. Overload is by far the most common reason. Second, you've overstretched it. So you've done yoga and things and you've really gone to stretch that muscle and that's irritated it. Thinking of that, one of the really common causes that I've seen during lockdown for it is people doing tricep dips with their arms behind them. And, you know, when you're pressing up and down on a bench, because in that position, your biceps tendon is stretched over the bone and then you're asking it to work in quite an awkward position. And especially if you're not strong enough in your shoulder girdle to properly control it, that tendon will take more strain than what it should and it overstrains it. And that's a very common way of injuring that part. And then the third way to injure it is if you have poor scapular stability or you swim, for instance, to the point where the scapular stabilizing muscles are so tired that they can't do their job properly anymore. So your shoulder blade comes forwards and now you're getting more compression and friction on the tendon as you're doing your sport. So especially for racket sports and swimming, that's often also a cause that the shoulder blade is just coming forwards too much and irritating it. And again, it actually comes down to overload because it's usually when people lose their form and they're not strong enough or they don't have the endurance for the volume of that activity that they want to do. So then they lose the control over the shoulder blade and that causes that injury then. Good. So what have I left out there? I think that's basically it with regards to why it's what it is and why it's caused. But now, how do we get it better? So there are 2 to 3 rough stages that we can divide it into. The first is the really reactive phase, where it is so painful. And if you try any type of exercise with it, it just flares it up again. During that phase, the right treatment is to offload it. to give it a bit of breathing space. Just allow it to calm down. You will strengthen it later on, but it has to calm down first. Now, what can we use for that? Ice is really useful on there to help calm the irritation down and just give you a bit of respite. But then also think about the positions you put your body in during the day. So if you're going to drive a car, for instance, have your hands on the lower part of the steering wheel that you can turn it that way rather than on top, which is more likely to compress that painful tendon. Also, another thing is, let's just see if I can show you this better. Depending on if I turn my hand this way around, I get gentle internal rotation in my shoulder. And with that, these structures come together and that painful tendon is more likely to be gently compressed, which can irritate it. Whereas if my hand is turned up, I get external rotation and there's a little bit more space for that painful tendon. So again, driving with your hands this way round versus that way round can make a very big difference, and it's such a small thing really. Other thing is, you'll be surprised how much not moving enough during the day can make it ache. So I've had patients where they've aggravated it through something else, but then their job involves sitting and working a lot on their computer. Now, if that muscle has to contract the biceps, keeping your arm in this position the whole time working, and especially if you're not at the right level, that can really irritate the tendon. So if that's something that you're struggling with, I would say, one, make sure your setup is really, really good, that you can get close to your computer. You don't have to reach forwards, that everything is relaxed as you're typing at the right level. And two, take regular breaks where you just gently move your arm by your side and just get some movement through that. So not wild movements that irritates it further, just move it. That silly old pendulum exercise that feels like you're doing nothing, but where you just bend over and gently swing it forwards and backwards. You'll be surprised how much better you can feel from that if you do that for about 30 seconds. So, I'm too lazy to demonstrate it on the floor, but I'll show you here. So basically what the pendulum is, you're standing on the floor, you place one hand on a desk or something that you don't fall over, and then you're leaning forwards and you're just gently swinging your arm forwards and backwards. Okay, and it's just to get a bit of movement. Now, if it hurts to take it like that, it's likely because you're being too rough with it. So just gently there, okay, and side to side, and you choose whatever movement is comfortable. I'm quite surprised sometimes with how much pain people will put themselves through because they think they should be doing exercise in a certain way. And then but it's painful to do it that way. Follow what your shoulder is telling you with this. If it likes moving in straight lines, just keep it straight lines. If it likes moving in a circle, do a circle. But always evaluate how you feel within the 30 minutes after you've done something. Okay, so that's the first thing, is make sure your setup with computers and things are good. Keep it moving during the day, but don't try and do strength training exercise yet. Avoid positions where your shoulder has to lift above 90 degrees or where you have to keep it at that level for a prolonged period of time. Adapt that. An exercise that's really useful during this phase that doesn't actually exercise the biceps per se, but helps create more space, is a simple one where you just set your shoulder blades. So it's not pushing your shoulder blades down and back, because that's going to cause more, that's just not how we set shoulder blades. It's literally just get them out of the way. Just open the shoulder blades up. If you find yourself sitting like that, just open the shoulder blades up and just hold it there. And usually it's difficult to remind yourself to do that type of thing. So 3 times in the day, stop and think, okay, shoulder blades back, grow tall, hold for 10 seconds, relax, and repeat that 6 times or so. So the whole aim during this acute phase is just to settle it down. Be careful, if you're somebody who sleeps on your front and you're going to sleep like that, you will not be able to move your arm that next morning, because that position really compresses that painful tendon the whole time. And it's when you try to move after that that you'll find that it doesn't work. Also, if you lean like this while chatting to somebody, you're going to have the same effect. You're squashing something that's really painful. And when you try to come out of it, it's going to be super, super sensitive and sore. So avoid those type of things. Good. So what have I got out of there? The other important things with regards to this is relative rest. So it doesn't mean that you have to stop all exercise, because remember that tendinopathies and tendonitis comes in varying grades. So if yours is not that painful and it's only specific things that irritates it, you can still be as active as you can, with as long as it doesn't cause an increase in your pain afterwards. But avoid stretches during this phase. If you're going to do any stretch where you reach up the back or stretch your arm back, that's likely just going to irritate it. Okay, so then if we move on, shoulder is starting to settle down. Let me just get my notes that I don't forget stuff. You can start to slowly build your strength back up with it. Now, avoid the typical exercise that people give for rotator cuff injuries, which usually, if I had a penny for each patient with biceps tendinopathy who's been given this exercise with TheraBands, pulling it out, turning it in, but meantime, it's not the rotator cuff that's injured, it's the biceps tendon. And as you're doing this motion, you're grinding the tendon against the other things. And guess what happens? It makes it worse. So don't do any of those full rotation motions especially during the early stages. You can get back to that several weeks later, but not at the start. If you wanted to do any strength training of that type, but to be honest, I also find that it doesn't cope with it in the first few weeks, only later on, is isometrics, where you hold the band and you step your body away. So it's pulling against it and you're not moving, but we're not getting that rotation motion. And you can do it to both sides. So if you think of it, if you're gonna imagine this is a stretchy band now, it's hooked in here. Okay, so if I have it there and I step away, it's gonna try and pull my arm in, but I'm not letting it move. So I'm working my rotator cuff, but I'm not getting the rotation. And the same thing for the opposite way then, just stepping away, keeping it isometrics. You can start some gentle bicep work as well. Watch out where you have your elbow. If your elbow is going to be back there and you do bicep curls, you've got a bit of stretch there. And for some patients that can be irritating. So it's a good idea to rest your arm forwards. Like in the gym, they've got you on a bench, arms forwards, and you can do your bicep curls there. That's a nicer position for the tendon often to start in. But go lighter than what you think you should. Okay, so forget what you used to be able to do and test it with super light weights first, because it's easier to increase the weight when you feel it's too easy and doesn't flare it up. Then if you go too heavy and you're irritated, then you've got to start from square one and wait for it to calm down again. So whenever you start strength training, start really slowly and build it up. Also, don't do strength training in the first few weeks that involves lifting higher than 90 degrees, because we just want to avoid that compression component at the start. So things like seated rows can be quite useful, because you're strengthening your shoulder blades and everything that takes it back, but we're not actually getting any compression there. You can do a little bit of flexion if you want. I usually start my patients with just the weight of their arm first. If they are happy to do 3 sets of 15 of that, we start adding some weights. I don't tend to like to use the exercise bands for any flexion type things, because the resistance of the band increases as you lift up, and your shoulder is usually weaker in this spot than it is there. So it doesn't quite make sense, because as you get to the weaker range, the band is now tighter. So it's much better option to have light weights that you use. And if you don't have weights, remember 1 liter of water equals 1 kilo. So you can have bottles of water that you fill up and you can get to quite a bit of weight. And if you think, well, I don't have a big enough bottle to hold it all, pop it in a bag and use that. Okay, so then there are specific exercises that's often a bit problematic when you have a biceps tendinopathy or tendonitis. And it is usually push-ups just doesn't work at the beginning, and it's because of the compression component in there as well. So to think of a patient example, I had somebody who wanted to get back to yoga and doing yoga poses where you go deep into a slow push-up, hold it and come out. Now that's a massive load on that biceps tendon. And we had to start with really low load positions and against a wall. And then once it accepted that, we increased the load to doing it on a table. And then we increased it to doing it on knees. And eventually we got to being able to do it on her feet. So it's important to think about, okay, where do I want to get to? What does my sport or activity involve that I want to be able to do? And then you break that down into the building blocks. And you start with really gentle, see how it reacts, build it up until it's happy there, and increase the intensity over time. Yes, what else is problematic with that? That's pretty much it. So yes, it's important to strengthen it, but choose your exercises well, avoiding stretch in the tendon during the first lot, avoiding compression in the tendon in the first instance, and going really light load to heavier load. But then also, if it doesn't work, what else can you use? Now, people always ask about medications. Remember, I am not a doctor and I do not know if you can take different medications. So check with your GP before you take things, because even things like anti-inflammatories that people often think, it's fine, I can buy it over the counter, can't be bad for you. They have side effects and they interact with different medications as well. So make sure you check before you take any of that stuff. Now, anti-inflammatories is not normally prescribed for tendinopathies or tendon injuries because there's not thought to be a very big inflammatory component to that. With this one, I find that it either helps people or it doesn't. And the ones that it tends to help more is the ones where I usually suspect that they've got a bit of a bursitis as well, where it's inflammation of the bursa in the shoulder. So if yours is remaining really painful and just doesn't want to settle down, it is worth speaking to your doctor and asking if it's okay to take a short course of anti-inflammatories and just seeing if it would make a difference. Because if there's a bursa involved there, it can help to calm that down. Injection-wise, people often like to stick a corticosteroid injection in there to calm it down because it works so well to calm the pain down. I wouldn't get that. Definitely not in the first instance. It would have to be a very, 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 very last resort. And the reason for that is that corticosteroid is not good for tendons, so it weakens tendons in the long run. And besides the biceps tendon, you also have your rotator cuff tendons and all in that area. So it's a last resort. There are other things that I would consider before that. Shockwave, for instance, is something that I would consider for that because that can be useful. But again, it's got to be done at the right time. If it's a super, super inflamed, painful one or irritated and painful one, shockwave is likely not the right thing to use at that stage. But most of the time, I find that these tendons do calm down really well if people just allow them to calm down. It's often the case when people just don't rest them enough and are too anxious to get back to gym activities or just use it too much cleaning the house or doing housework or just don't really think of the shoulder. They just wanted to get better without actually protecting it a little bit. If you look after it and you try to avoid those positions that's painful, it usually calms down very well within a few weeks. The rehab period for this thing is quite long. If you've done a proper job of flaring it up, it will take you anywhere between 4 to 6 months to fully get it back to full strength. Now that of course depends on what activity you want to do. If you're not somebody who does a lot of heavy arm things, it was total fluke activity that brought it on, you'll be comfortable getting back to your day-to-day tasks within 3 months maybe. If you're somebody like that other person who does yoga and needs to do really high load push-up type movements, you're going to be in the category of 4 to 6 months to get back to that. So it all depends on what you want to get back to as well. Okay, I hope that was useful. Now remember, if you need more help with an injury, you're welcome to consult one of the physios at sportsinjuryphysio.com via video call.